everybody. Good afternoon. This week our topic is pregnancy, and I'm your host, Ange, or Anjali if you like to call me, and my profession is health and wellness coach. Okay, Dr. Priya is here. I'm going to wave at her. And then, yes, and of course, I'm the founder of this page. I'm just waving at everyone. And then, yes, today we have a very special guest, Dr. Priya, to educate us through our pregnancy topic. And she's the gynecologist and obstetrician at Grace Private. And her, I'm just trying to accept a little bit about her. She is a women's health advocate, mom of 2 girls, and she is fluent in French. Hello, Dr. Priya. I'm just introducing you. And I'm just about to say that, yeah, you are fluent in French. And you reside in, of course, in Gold Coast, right?
Yes, yes.
Yes. So, yeah. Okay. So I just wanted to, say thank you so much for coming here, for your time. And, I know you're a bit tight in your time, but then again, you wanted to educate us and bring the awareness in this topic. And we are very grateful for that. And yes, thank you so much.
It's my pleasure, and thank you so much for having me, Ange. It's great to be able to talk to the community without them actually being in my office. So I think awareness and prevention is gold, and
Yes.
information, knowledge, and power.
Absolutely. That is what I would like to do. Together we can do so much better, right?
Yeah.
Bringing the awareness and educate the community. So before we start the conversation, I just wanted to say that what did I want to say? So this topic is all about to inform people, but not a specific diagnostic for anyone in particular. And this is general knowledge on our topic, and we acknowledge that this topic can be expanded further. And if anyone would like a specific information or inquiries about the particular thing, maybe they can contact you and write a message directly, or go to their health professional, right?
Yes, absolutely. Yeah, I'm happy to get messages on Instagram, of course, of a general nature, and yeah, very much. It's I manage it all myself, and then if you would like information on my rooms, you'll be able to see my Grace Private information here as well through my Instagram profile.
Yeah, awesome. And we do have Q&A at the end. Please, if you have any question, stick around, and then write down your questions, and we'll be Dr. Priya will be happy to answer it to you, I think.
Yeah.
I'm like, yes, she's going to answer you. All right. Okay. We will start with the first question. So, and I think we have to, if everyone can hear us, please give us a thumbs up so we know you can hear us loud and clear, and we can continue with our today's conversation.
I'm impressed.
Okay.
People joining that I know, that I respect, are my colleagues. It's great. Welcome everyone. Thanks for the support.
Yay. Yeah, that's awesome. Thank you so much, everyone, for coming here today. We got all the thumbs up. So we will start with the first question. So, yes, I wanted to ask the symptoms, but would you be able to define in a very simple way that what is pregnancy, and what are the common symptoms that we know that we might be pregnant?
So I think the most common symptom will be the absence of your period for a woman. And that's usually what most people will notice. But that doesn't apply, for example, to people that have irregular cycles that aren't like clockwork. So women that by polycystic ovarian syndrome, people that aren't really tracking their cycles, people that have contraception and they're assuming that it's working, and that aren't expecting falling pregnant. So, you know, your period is you know, what most people will look out for, with a lot of provisos, I guess. And then other things that, you know, women will talk about will be tender breasts. So that can be getting a hug and you're like, oh, that's really sore. The other one is just getting up in the night, commonly to go to the toilet very often. So yeah, peeing a lot is one of the first signs of pregnancy. Some women just tell me they have a metallic taste in their mouth, and that's the only pregnancy symptom they have, that their taste becomes altered. So I'd say, you know, breasts, absence of periods, and the urinary symptoms are probably the most common. And I would usually divide women into those that are trying to fall pregnant and those that aren't, and surprised. And so they're not necessarily paying attention to these symptoms as much as a woman who is, or a couple who are actively trying to have a baby.
Yeah. Okay. So the absence of period, and then metallic test for, I guess it's everyone has a different experience, right? It's not particular, but yes,
we are all,
absence of period.
Smell is one. So some people will just suddenly hate the smell of coffee when they love it, and they were like, that's weird, like, I love coffee. Or they might not like their partner anymore. Yeah.
Okay. So with me, I had Marina in, but I still felt pregnant. So so I was the one of the exception one.
You are.
Yeah. So So but anyway, so what would you say if you are, you know, a little bit confused, or you are like feeling a bit strange, you would suggest people to go and see their GP, or what would you say? What would you recommend?
I mean, even before that step, you know, if a woman is suspicious that she's pregnant, you know, the great thing about being in a developed country is that you can just pop off down to the local pharmacy and go and get yourself a pregnancy test.
Yeah.
You know, see from that point onwards before even making an appointment with the doctor.
It's not like in Nepal that you would have to hide and, you know, like cover everything, and to it's not like that here. So you are free to do those kind of things. So
yes,
okay,
we are
cool. Awesome. So so we covered the common symptoms that we might be pregnant. The first question, and the second question is, how can what are the different methods that we can use to know that we might be pregnant, to check the pregnancy?
So we mentioned urine pregnancy tests. You can have a blood test, which will be looking for the pregnancy hormone called HCG, without getting too technical, but it's the blood test version. And it's more accurate and it's more sensitive as well, particularly for the early phases of pregnancy where your urine pregnancy test might not be positive yet. And then ultrasound can also be used to diagnose pregnancy, particularly for women that don't know how far along they are, and they may be much further along than they expect, and everything is visualized on an ultrasound scan. Of course, for blood tests and ultrasounds, you usually have to go and see a general practitioner to be able to obtain the referrals to get these tests done. You can't go down to an ultrasound place. There are some walk-in centers, particularly for women that are worried. So if a woman has found out she's pregnant and she's worried, then, you know, definitely, for example, at Gold Coast University Hospital, they have an early pregnancy service. And even at Haven Ultrasound, which is my preferred ultrasound provider, they're a wonderful company run by obstetricians and gynecologists. They also have a walk-in service for women that are worried and they know that they're pregnant, and they're worried, for example, if they've got pain or bleeding.
Okay, fantastic. So what I understood is there are three type of the checks that we can do: urine test, blood test, and the ultrasound. Correct?
Absolutely, yeah.
Yeah, awesome. So okay, so that was if you have just joined in our chat, we have just covered two questions: the common symptoms of the pregnancy, and then how the different methods that we can check the pregnancy. And now number 3, we're going to go to yes, and this one I find it you know, I did that too, that for a few months, I can't remember how long we decided not to tell people. And
Yeah,
like lots of people tend to do that, not to tell people that
yeah,
we are pregnant, just
yeah.
to be sure. Is that we getting too worried or scared, or is it a genuine worry? What is it?
I think couples will react however they feel appropriate.
Mm-hmm.
Um, my personal circle of girlfriends, one of my girlfriends texted us all a photo of her positive pregnancy test, and
Yeah.
told everyone. And I think that's wonderful. I think if people are liberated to feel that way, then yes. I also think that conversely, if you are worried about loss, which is the main reason for why people do not tell their family or friends, that it's a bit, I think it's really difficult, because let's say you do have a loss, for example, and it's a really difficult time to go through, and then you're essentially doing it alone because you haven't told anyone.
Mm-hmm. Yes.
And that's really sad, and it's almost like a double-edged sword. Miscarriage is probably more common than most people think, but it is
Mm-hmm.
one of those things, again, we're very poor at talking about.
Mm-hmm.
Women, even amongst women, we supposedly talk
Yes.
to our girlfriends, everything, but loss potentially is not one of those things. And especially for men, that's very stereotypical. And I know I'm generalizing a lot, and certainly don't want to offend anyone, but that's the status quo in general, in my experience. So I don't think there is a right or wrong answer to that.
Mm-hmm.
In my personal experience, I think it is, one does get nervous, but what's the value of not telling people if you then, if everything goes well, then great. You've potentially lost a few weeks to be able to talk to people about the exciting news that you're falling pregnant.
Mm-hmm.
Um, so it's a tough one. And then the other thing is that, if a woman is really unwell during her first
Mm-hmm.
trimester, often, nausea and vomiting in pregnancy and fatigue is very, very difficult to do their job,
Mm-hmm.
or to function, even if you're not working, for example, just functioning. And so if you haven't told anyone, and then you're reluctant to access things like sick leave or medicines or take time
Mm-hmm.
off, often is the time that you really need it.
Mm-hmm.
And so I think it's really tough. I wish more people would talk about early pregnancy, and hence why I'm so happy to be here. But it's a really difficult one, and I don't think there's a right or wrong answer. I think it does very much, depend on your circumstances. Unfortunately, some couples will suffer more than one loss, and they'll be even more nervous the second time around.
Yes.
And yeah, it's really difficult. I think it's really, really tough. The first trimester,
Mm-hmm.
nausea is one of the most undertreated conditions that exist in medicine. Nausea and vomiting in pregnancy, so undertreated.
Mm-hmm.
Most people will not seek treatment because they think it's normal,
Mm-hmm.
but you don't suffer. I remember very well both my pregnancies. I was very nauseous with both of them, and it was really, really tough. It's constant. I know this is coming up. You wanted to go into this, but we've led into it anyway, which is some women feel nothing and they don't know, and they kind of, the only sign they have of pregnancy is their urine pregnancy test or a blood test or a scan, and they can't feel anything else. And those women sometimes feel upset about it, because there's nothing telling them that they're pregnant. And then conversely, if you are very sick, it's almost like you're pregnant, but then you're really, or if you can't eat or even swallow water. So there's quite a spectrum of how women feel when they are pregnant, particularly in those first few weeks when you're deciding whether to tell anyone. And who knows the journey that a couple have gone through that to get to that point. Some people need assisted fertility therapy. Some people it's planned pregnancy, cultural differences. Maybe a couple is unmarried. There's so many different things that can influence those decisions, let alone, being worried about loss.
Yeah. So we have a big question here. Kido Olisen. Sorry if I'm not pronouncing your the account name properly. So she says, I am pregnant with twins and both have bradycardia.
Yeah.
Last ultrasound at 6 weeks, 1 day, baby 81 BPM, baby B, 101 BPM. Having a follow-up scan on Friday when I'm 8 weeks. Is there anything I can take to help?
Yeah, look, it's a tough spot to be in. And the short answer is no, there's nothing that you can do to influence what's happening with your babies, and time is the only thing that will tell us. Sometimes we can actually, ultrasound is so good in this day and age that we can actually capture pregnancies much earlier. And so sometimes we can capture pregnancies before the electrical system in the heart has developed fully in order to make that faster. So it's not necessarily a bad sign that the heart rates are on the lower side, but it could also be. So it's a tough spot to be in. It's one of those things that, the waiting game is very difficult, but there's essentially, nothing that you will be able to do and to influence that between now and then.
So for now, what would you, so she can, just look after herself, right? And the baby is the best she can take care of herself.
Yeah, during a difficult time. And this is what you're saying, if she hasn't told anyone, doesn't have a wider network of support to be discussing this with, that will be more challenging. Of course, I'm assuming that, there's another party involved in a partner, and hopefully that level of support is there.
Yes. So reach out for support as much as you can, during this hard time, isn't it? Because lots of times us women, we try not to bother other people. That is our thing, isn't it? Oh, we don't want to bother, we might be too much burden, and then we end up having burnt out ourselves, right? So,
Indeed.
Yeah. So it's better to look out for help, I guess. So please reach out for help if you need to.
I think the only thing is that, again, worrying or concerning features early stage of pregnancy are usually pain or bleeding. And again, neither one is necessarily equal to a bad outcome or loss, but then, when they're present, they're much more worrying, and they can be a sign of happening. But if bleeding was in the picture, then there certainly are things that we do that are evidence-based to help with bleeding in early pregnancy. But I think one hasn't mentioned that.
So would you, I know it's like if during pregnancy, I think it's very common for us mothers to worry about, the baby, and, so during that time, is there any, the tips and tricks that you would give to people, the mothers, that how we can calm ourselves down, meditation or breathing or anything like that?
Absolutely. So doing things, so some people, will commonly, if they're active, doing exercise, the moment they fall pregnant, they may stop those things thinking that they're a danger to their baby, especially in the early stages. And that certainly is a big misnomer. And whatever you're able to do prior to falling pregnant is perfectly adequate when you're pregnant, and even more so important. So, in general terms, what I was going to say was, when you find out that you are pregnant, and most people will want to do the best that they can do.
Yes,
sometimes the body will have other plans, and what my women is that you do have to go with your flow. We would all love to be able to eat nutrient dense food in the first, there's a lot of literature out first 1,000 days in a baby's life, which includes this very early stage in utero. And but we may have, cravings, and we may have aversions. So it's common for people to go off meat, for example, and iron is very important in pregnancy. And if you're off meat, how are you going to be getting iron? And I very much say that you've got to really cut yourself some slack, sometimes, and, this is assuming that someone is, does have these changes, but you need to do whatever you need to get through, to be hydrated, to get some nutrition in, to reduce the sickness as well. Usually it's worse when you're hungry or when you're tired. And in, you know, mental health, I'm a big fan of exercise for mental health, mindfulness or mindful practice, whatever that is for you, because it varies. Some people may wish to be still in their meditation. Others are mobile in their meditations, and taking a walk along the beach at sunrise is their form of meditation. So whatever, I think being in tune with yourself is important. And doing those things in this early stage. The other thing I was going to say is that, you know, we try to manage women and their symptoms if they have any as well. And there's a lot of things that are out of our control. That we cannot influence how a baby is developing. We cannot influence how their genetics have been mixed. And, you know, broadly speaking, that is. So, and also know that, trust your body, that your body will actually take everything that it needs for pregnancy. So, you know, we as women can become nutrient deficient, and that's usually because our baby is actually taking those nutritions and they're replete, but we will be depleted. And so what we make sure that both buckets are being filled. So taking prenatal vitamins is important. But again, if a woman is feeling unwell and she's gagging with her toothbrush, then, you know, most multi are very large, and I'll be like, do you know what? It's okay. You know, there's one small tablet that's very good called Blackmore's Folic. It's one of the smallest tablets. It just has those two nutrients in them, and that's pretty much the main things that are important. The multivitamin is great, but, you know, for the longer pregnancy, in the first trimester, those two elements are very important, iron and folic, and there's a little pink tablet, and most people can swallow that.
Yeah, fantastic. So some days that little thing is big help, isn't it?
Yeah, absolutely.
So we have the comment here. Here come the orgils. Support is the most important thing mentally while pregnant. No matter how far along you are, please make sure you have at least one person who can help support. Yeah.
Wonderful.
So yes, absolutely.
We do. And the comment comes from a lovely couple that I know. So that means a lot.
Oh, that's awesome. And all the family know we have a wonderful group of friends that are very supportive. We are hopeful for a positive outcome. It's from the lady that she mentioned about the twins earlier.
Yes.
Yeah, our best wishes. Hey,
I didn't mention faith before. Again, so a lot of people they're faithful. They will rely on their beliefs, cultural beliefs, religious beliefs, and, you know, we must do whatever we think, you know, is going to make us feel better.
So okay, so we will move on to and that went like whole heap of answers for you, big question for you. The another one we're going to talk about is here's another question is why some people feel sick at the beginning of the pregnancy and later on it's and we phase out of it. Why is that? And is there anything we can minimize the sicknesses?
Oh goodness, yes. Yes is the overall answer. So I don't think there's a medical answer for why some women feel sick and others don't. I guess I think about it a little bit like immunity, which is all respond to new things differently. So when you've been exposed to pregnancy hormones circulating in your bloodstream, you don't know how you're going to react to it, and that can also with subsequent pregnancies. So you may have been fine in your first, but the second one is actually worse. And the opposite is also true. Some women can feel very sick in the first pregnancy and be fine the second. Pregnancy hormone has a very similar effect to one of our own hormones that's always circulating, called thyroxine, which is our thyroid hormone, the core of our metabolism. So it does speed things up a bit. So it does have a lot of things that it can have similar effects too. But it's really difficult to predict who's going to feel sick and who's not. I kind of, when someone says to me, I don't feel anything, I'm like, well, don't tell anyone. Because it's common knowledge that most people do feel sick. And then also the majority of people it does get better. So by the 12 to 14 week mark, as you're entering the second trimester, the majority symptoms will resolve. It's only a very small percentage of women who would then go on to have what we call persistent nausea and vomiting in pregnancy. And that's
my symptoms weren't as bad, but the onion were my triggers. So my husband banned the whole family to eat.
Yeah.
He's like, no one is having onion. So yeah, and that helped me. But anyway, yeah, it's just if that helps to anyone,
yeah.
to whatever triggers you.
I just used to have lentils. For me, I really wanted something very salty and very kind of tasty. Everything else tasted bland. And so my mother's lentils, or my mother's recipe for her lentils, was pretty much what got me through. And I think second time around, I just managed to ignore things a little bit more. It was a more minor.
Second time, I think we don't have time to think about it because we have two kids happening.
That's so true. You don't have time to indulge in your nausea.
Yes.
Goodness, I would love to be able to talk about the things that can help, absolutely, and they don't start with medicines. So things that are in our culture, in Indian culture, and a lot of things are very accurate. So things like ginger is well known to be a non-medical or medicinal, pharmaceutical, I should say, relief for nausea, and that can come in any form. So some women say they try little sweeties. I even have tried the Twinings ginger and lemon tea, simply bought off the shelf, and I found that great. I just used to constantly have one of those on the go. Yeah. You can also buy from a pharmacy ginger tablets that usually are combined with B6. So B6 is another natural form of anti-sickness. It's called pyridoxine, and you can take that regularly every day. And this, again, the tablet form will depend on whether you're going to gag or be able to actually take it.
People need to talk to the GP about that? Sorry.
Beg your pardon?
Yeah, no, for the tablet, the ginger tablet, does the people need to go ask GP before they want to take it or not?
No. Normally, if you pop into a pharmacist, and if you want to have a chat with a pharmacist, most pharmacists are pretty happy to say, these are our range. They're not behind the counter shelf, and you can just go and have a read and have a think. There'll be lots of different versions. Elevate do one, Blackmore's do one.
Yeah.
But natural ginger, if you want to grate it and put it into tea, absolutely fine. Or cook with it. So ginger is one of the most common. And then I was going to mention the acupressure point. Buy little wristbands that has a little knob here that can.
Yes.
Yeah. Some people use it for motion sickness when.
Yes, we used to, when we were working on a boat, we used to have that band. All the girls had a band. Yeah. Yes.
And the other thing is how you're managing your pregnancy as well. So eating small amounts, little and often, can help with nausea reduction, because hunger tends to exacerbate it. And fatigue, I mentioned it before, but fatigue is terrible. And so the more tired you are, and we tend to be exhausted in the first trimester, 12 hours sleep, more, just not being able to keep your eyes up more than 8 p.m. So making sure that you're getting enough sleep and listening to your body, trying maybe try and have something like some toast or a cracker. There is, if you Google what to eat in the first trimester to reduce sickness, you'll see things like try to avoid acidic foods that can sometimes upset the stomach. But it does depend. Some women really crave grapefruit. I know my second pregnancy, I spent the whole pregnancy drinking tonic juice because I just wanted that bitter grapefruit taste.
I had the lemon, both kids, lemon, crave for lemon and grapefruit.
That's
I would have grapefruit for lunch. It was that, yes.
And some women absolutely cannot tolerate citrus and they will want to drink milk. So it does vary, but optimizing your general health with sleep and regular small meals. And then kind of once you've exhausted those options, then definitely we can certainly up the ante, and you can have, prescribed medication to try to reduce nausea. In all honesty, a lot of the stuff just doesn't really work to take the nausea actually away, and they can be more effective actually stop vomiting. And then, you know, there are various different types. There are little tablets that you can absorb under the tongue. There are some that you take orally. And then, you know, taking it from there. One that's, again, over the counter that is usually recommended by pharmacists is actually a sleeping tablet called Restovit. It also has a brand name called Sleep Aid. And bizarrely, so people think, why are you giving me a sleep tablet, Dr. Sokh? And I'm like, I'm not actually trying to get you to sleep better. I know you're doing that well. In a very small amount, it does help with your nausea. So just the way that the sedative effect will also act on the same pathways that help to reduce nausea. So the box will say take 1 or 2 tablets to aid with sleeping. I will say start with a quarter to a half a tablet, and you must take it every night as a preventer rather than a reliever. And sometimes that's really magic for some people. And some get insomnia. I didn't mention that, but some women get insomnia in the beginning part of their pregnancy, and so they very much need the help to sleep as well.
Yeah, and Dr. Francis says, and reflux.
Yes, absolutely. Thanks, Francis. Yes, the reflux. Irrespective of the size of your belly, it's all hormonal. So yeah, that's a great one. Thanks.
Yeah. So okay, listening to your body, sleep, eating small meals, and what else was it? And taking ginger tablets if you want. Yeah. So yeah, if you have any more, go to Dr. Google or Dr. Priya.
I'm not doodle. You can come to Dr. Sokh.
Yes. Yeah, you have to go to your doctor.
Look, to be honest, your first point of call should always be your local GP.
Absolutely.
And we have so many GPs in the area. Dr. Francis Knight is one of them. We have some wonderful we have 3 lovely GPs at Grace Private who are very skilled in managing early pregnancy care and antenatal care as well.
Yeah. Awesome. And we love Dr. Francis.
We do.
Thank you for coming here, by the way. And okay, now I wanted to ask about the nutrition, nutrition, and then I don't think I mentioned it in the question to you, the exercise, movement, and the nutrition. And then, and then we are not as clear, what is the healthy weight or healthy weight for the mothers and baby during this time. Because it's a little bit, but anyway, yes, please, go ahead.
What you're getting at. So I think the myth to dispel is that you do not need to eat for 2. The requirements of pregnancy is about an extra 500 per day, which is not much. Actually, it's not as much as one may think. And so that is probably equivalent to half a sandwich. So most women can achieve that very easily just with their normal appetite in pregnancy. So eating for 2, definitely not. Even if you've got 2 in there, still not.
Yes.
So it's, and then when we talk about, I guess, weight gain, it does depend on your starting weight and your starting BMI. Now, BMI it's a little bit, it's not great in some ways, but it's one of the tools that we have. There are, and in pregnancy, it's still one of our benchmarks. So, in a normal woman with a normal BMI who falls pregnant, we can gain and expect to gain anywhere between 5 and 16 kilos. And that would be absolutely normal for that woman to gain. If we're starting and we are underweight, then that woman should need and would be advised to try to gain more than that amount. So maybe up to 20 kilos. And then conversely, if a woman's BMI or is overweight when she falls pregnant, then we may reduce the targets for weight gain, or in some extremes for a woman to actually remain weight neutral. Exercise is always encouraged in pregnancy, and there are certain times where we might actually for a medical reason say no, but assuming that everything is well and your pregnancy is progressing nicely, and you would, as a doctor would call, you are low risk, then you are able to live life as if you weren't pregnant. It's certainly not a disease, much as it can make us feel sick. But, you know, often women are more energetic in the second and third trimester when they're pregnant. And so things like walking, swimming, doing what their regular gym activities were, the things that you need to adjust normally, for example, in the gym, will be, you know, your center of gravity will change when you become much bigger. And therefore, you know, if you've got, you know, I've had a couple of athletes during the course of my career who lift weights, and, you know, you need to adjust your bar path when you're lifting, and you just adjust the workouts. And I think most of the living in the Gold Coast, everyone is so health conscious.
Yes.
That there's lots of avenues that, you know, reformer Pilates, things that can be adjusted for pregnancy, things like so. Yeah, trying to maintain a good healthy diet when you're able to and you're not feeling too sick is always good, the same way that one should be when they're not pregnant. But obviously pregnancy is one of those times that a lot of things are highlighted. It makes you think of these things more consciously because there's another person that you're thinking about
growing. Yes. We are conscious about everything, right? Because we want the best.
You do.
For the baby.
And we do. We lay foundations for our child in utero. Yes. You know, the environment that they are exposed to can set the pathway for their long-term medical.
Yeah, absolutely. Thank you for that. And what are the, so we will go, we just got Fatima from the cultural dietitian. She was my guest last week. So we spoke about the, obesity last week. So thank you for coming, Fatima. And so the other question is, so what are the other important things you would suggest mothers during this time, if you can think of anything that we missed or something like that?
Without making things too much, I think you know, deciding on how, you know, your model of pregnancy care is potentially something to think about. Again, when you fall pregnant, maybe even beforehand. It's, you know, I work exclusively in the private sector, and I'm feel very happy, you know, looking after women myself with wonderful colleagues that I work with. And, you know, that can vary for a family. It can vary where you are location wise. Your access to help people in remote areas may not have a lot of choice, like we're spoilt with here on the Gold Coast. So, you know, I think you've covered the main things, you know, that people can be worried about in pregnancy. And then, as you said right at the beginning, which is pregnancy affects us all differently. You know, some people, you know, we have these wonderful things that happen in pregnancy that are screening tests. So we have ultrasounds that are designed to detect problems or things that can come up. And it's, you know, ideally we all want nothing to come up, but they can do, you know, we detect any abnormalities physically with babies, you know, at a percent between 1 and 3 per pregnancy. And so I think being open-minded when you're pregnant, I think is probably one of the most important thing, and also does well for good outcomes, I would say. I think, you know, being open to things sometimes just happen, and it's irrespective of what you do, irrespective of what your doctor is doing for you. Things crop up and we just have to go with it. There was I got a gift before we had children, which, you know, just says the time is never right. So you know, sometimes there's another lovely phrase, which is, you know, life happens in between the time plans. I think pregnancy is one of those things, you know, that sometimes will throw you a curveball. And if you have your tools to try to deal with these curveballs, and if not, and if it's swimming and you're a unicorn, and great, good for you.
Yes, with the rainbow.
That's it.
Exactly. Yeah.
And, you know,
and
ultimately,
lots of times what I found is that these days we have so much information all over the social media everywhere. And at that time, I think it is informative, as well as it can create that expectation, overwhelming and expectation. Oh, that person is in that stage, why I'm not in that stage? Or, you know, that person looks like this or that. And I think that how do we deal with that?
Yeah, great question. Gosh, definitely can't answer it, but you know, pregnancy is just, it's the tip of the iceberg. You know, you carry on, you become parents. Again, different philosophies about parenting, and again, an overwhelming amount of information available out there, some reputable, some not so reputable. You know, some people can, you know, be very by what they read, and some people can be very upset by what they read, even if that is true or not. So I think I will go back and say my conclusion definitely, if you said to me, you know, what advice would I give to people, would be to be open-minded when to having babies and falling pregnant, deciding to or not deciding to, and welcoming a pregnancy. You know, being open to all options, and is a very healthy way to be when it comes.
Once I read this this sentence, try your best and forget the rest. That's like with a kid's book, in a kid's book, I think. Try your best and forget the rest.
That's it.
So we are here at the end of our questions, and you know, if I'm going to ask the viewers, if you have any questions, please write it through, and during our waiting time, please let us know where we can find you, Dr. Priya.
So I'm here at Grace Private. As I said, you can message me on Instagram. You can call directly through to the rooms. If you just Google Grace Private, you'll see we have my profile. I can read you my number. I'll make you all laugh to say that I don't know it off by heart. It's 75594 7632.
5594.
Here at Grace Private, but please be persistent. And here at Grace is ask for grace. So if you are thinking about pregnancy, if you would like preconception counselling, if you, or you know, even in, I know this the focus of this Instagram was pregnancy, but you know, we're gynecologists as well. But you can go and see your GP and ask for grace. And of course, I have lovely colleagues here as well, but I'm very happy to see all manner of women through any age of their menstrual or reproductive journey or postmenopausal journey. So we follow such a breadth of conditions during our lives as women. And you know, I definitely think it's you know, great to be a woman, and we're very lucky. It can be a bit difficult, you know, we've got all these hurdles to go through, periods, having babies, then menopause, you know. But I think it's, you know, this day and age is a great day to be female. So
well, I guess that's why we have all different, you know, like range of health and wellness professionals, right?
Absolutely.
So it's on this side of the world, we are very lucky to be able to have all these resources. Because I'm from Nepal, and I know, you know, in Nepal that women, they, you know, still so not backwards, but still don't know so many things, you know, regarding pregnancy, because we don't talk about it at all. Or, you know, my mum hid her tummy for my youngest sister, and I had no idea that she was pregnant.
Wow.
And and when she was born, and then I was shocked, you know. And so it is like that. So it's and it's not it's very interesting journey. So, you know, and in here we have resources, and we have people to support and help, reach out, and, you know, and because we are not in the other side, right?
Absolutely.
Yeah. All right.
Much.
Yeah.
Me and helping me to, you know, connect with our community and spread the word, and just maybe hope to dispel some myths about pregnancy, and give everyone a little bit of an intro into what they can expect.
Yeah, we truly appreciate your time. And here comes the Orgils. She says, thank you, ladies, for informative. Have a great day. Hopefully see you in the clinic again soon with the good news, Dr. Sokh. Thank you.
Yeah, thanks.
Yeah. Oh my goodness, it's getting hot here. All right. Thank you so much for coming here today again, and for your time, and our community is really grateful. So thank you so much, and we'll see you next time.
My pleasure. Can't wait. Bye-bye.
Thank you. Have a great day, everybody. Bye.